Well, one thing that the Reform Project has really shown is just how unbelievably complex the system is for ensuring good regulation for the development of data-driven products and technologies. So there's a real patchwork of regulatory systems. Different regulators are responsible for different parts, there's different statutory bodies, lots of different organisations that have a say in how these things should be developed. And from the perspective of a developer, someone who wants to innovate and use data in novel ways to help the NHS, it's going to be a very, very confusing and complex system to try and navigate. But I think the Reform Report really takes us a good step forward in just understanding and mapping that really complex landscape. So it's a great start. I would say think early on about that long, complex pathway, and particularly how you're going to articulate what the benefits are going to be for patients and the NHS, and particularly for healthcare providers, for the people who are going to be using the tools that you're developing. It's not good enough to come up with a brilliant tool and have no idea how it's actually going to be deployed and implemented in practice. And as the Reform Report shows, there's quite a lot of complexity when it comes to actually deploying and implementing technologies, testing them for effectiveness, quality, safety, and so on. So I would say the most important thing is to think about those things early on and how you're going to develop a business model and a tool that will be able to address those kinds of challenges. A really important part of this is going to be leadership. And leadership saying, you know what, we can innovate in the NHS and we can do really great things to help patients and the healthcare service, and we can do that at the same time as having really robust standards and safeguards for data protection, for privacy, for ensuring transparency, accountability, fairness, fair distribution of benefits across the system. So I think leadership there is going to be absolutely critical to say we can do this right.